Okay, today we're going to be talking about the difference between custom orthotics and over-the-counter foot inserts. A custom orthotic is a device fabricated to the patient's foot with the foot in what is known as the neutral position, or the most effective mechanical position for the foot to work in. Unfortunately, oftentimes the foot doesn't remain in that position and it becomes mechanically ineffective. Therefore, an orthotic stabilizes the foot and it replaces the foot back into its perfect anatomical, mechanically most efficient position. An over-the-counter insert, however, is slightly different. In fact, it's quite a bit different. The over-the-counter insert supports the arch, stabilizes the arch, but does not necessarily replace the foot back into a mechanically most efficient position. And also, the over-the-counter insert is not customized to the contours and the position of the foot itself. A custom orthotic, on the other hand, is fabricated to fit exactly and meet the contours of the foot so that it's absolutely comfortable. An over-the-counter device is actually fabricated with the midpoint of the device, supposing that it's the midpoint of the foot. And oftentimes the midpoint of the foot is not exactly the midpoint of the foot. So if we take an over-the-counter device and we find the high point of the arch of the over-the-counter device, we find the navicular tuberosity of the foot, and you can find that by feeling for the talar navicular joint, sliding your finger down, and the prominence that's noted on the medial aspect of the foot is navicular tuberosity. You place the insert to the bottom of the foot, and the high point of the insert should line up with the navicular tuberosity. In this particular device, we see that it is far too small, and the high point of the device is nowhere near the navicular tuberosity. So we would not utilize this. We would not utilize it simply because the high point of the insert will hit in an uncomfortable spot on the foot. This would cause pain. Similarly, if we use a different device and we find that the navicular tuberosity is coming closer to the high point of the insert, this would feel comfortable, but our goal is to make our two fingers or the two high points exactly parallel. We have now what would be the perfect fit of an over-the-counter device where the navicular tuberosity lines up directly superior to the high point of the temporary device. While not 100% comfortable, this would give the patient as much comfortability as one could expect from a non-customized device.